Sonic, Oreo, Big Scoop, Cookie Dough Blast, and Sundae.
Cookie E.
Storm Alert meteorologist Brittany Beggs, only on Channel 3.
Last week we had a good time heading over to Orthopedic Surgical Specialists, visiting with Dr. Josh Lawson at his office there, talking about the practice, what makes it very personal and efficient for you when you come in as a patient. This morning we are back talking about a specialty that he has in robotic surgery. Good to see you.
Hey Julie, good to see you again.
So we were bragging a bit on you last week, the fact that you are a Chattanooga native, went to college up at Lee University, but you left the Tennessee Valley for a while to get some real specialty training under your belt. I did.
I spent 5 years in Milwaukee for residency, and then spent a grueling 12 months with a gentleman named Dr. Malkani. He's one of the innovative leaders in our specialty, specifically as it comes to integrating technology into hip and knee replacement surgery. Within that year, learned a lot about the integration of robotic technology into hip and knee replacement surgery. And this is a relatively new technology to our area, but it's been around since as early as 2006. And it's really kind of a twofold process. It's a highly integrated software package that allows us to three-dimensionally map the patient's anatomy, and then intraoperatively it gives us much more information about how to make better decisions that are specific for that patient during the surgery.
Okay, let me pause you a second.
Absolutely.
So you're one of only a few doctors in the area who has this training and is utilizing this.
Correct.
You do practice at Erlanger with the
Correct.
robotic. You talk about doing a 3D model.
Mm-hmm.
Does that mean that if it were me, you would do a model of my knee and then you could kind of get in there and practice what you think you're going to see?
Definitely. So we get a CT scan before surgery, and then using the computer software we have that three-dimensional model, and then we map it intraoperatively to correlate with that plan. We can also test soft tissue tensions and things like that, leg lengths if you're doing hips, the alignment of your knee and things like that. And then we adjust the component positions to help better balance the knee, give you better stability post-operatively, and help maximize range of motion and get a more consistent, accurate result.
Does that work as well on anesthesia time because the patient's not asleep for as long?
Correct. So it's actually about time neutral. It doesn't really add any additional time to the surgery once you get through about a 10 or 12 case learning curve. In my case, I actually can do them much quicker and I get a better result because I know whenever I go to make the first cut or the first step of that surgery, I've already got it planned out. There's not really any second guessing. There's not any need to go back and remeasure or redo a step because it didn't turn out like you thought. It gives you really unparalleled precision and accuracy every single time.
Do your patients have a chance to see that model before you go in?
I haven't in the past, but they're certainly able to if they're interested in it. We try to get the plan set up about a week in advance. If patients are really interested, yes, we can go over it with them beforehand and kind of show them how we've modeled everything. And then afterwards we can show them what we've changed.
So, okay, so is it fairly common that you begin with the model and then when you get in there you have to tweak it, so to speak?
Absolutely. So there's only so much information you get from a static scan. The advantage of being able to make the adjustments during surgery is you can stress the knee, you get some dynamic information about how the knee is moving, and then that allows you to tailor it in ways that we're not able to do with either conventional instrumentation or patient-specific cutting blocks. We have a lot more information at our disposal.
You mentioned it was a pretty grueling year. Was it just the 1 year in Louisville?
It was the 1 year in Louisville. Obviously, the 5 years before were just as tough, but this one was dedicated specifically to hip and knee replacement surgery.
So I think you told me that the conversation we're having this morning might be something that our audience kind of begins to hear about because there really is a push now to educate people on how beneficial this can be, so they might be hearing about this.
Absolutely. So this technology first came into our area, or in the Chattanooga area, around August of 2020. Obviously there's a lot else going on in the world at the time, but now as we see we're getting the pandemic under a little bit better control, we're able to push some of these newer technologies and newer techniques, and there's enough doctors now using it that it's becoming a little bit more widespread.
Is it something that you only use though for certain patients? Does everyone need this technology?
You wouldn't necessarily say everybody needs it, but it is available to everyone.
Okay.
So anybody who's undergoing a primary hip or knee replacement surgery can benefit from this technology.
Okay, so here is how you can come and talk with Dr. Lawson yourself. We mentioned this last time, but one of the benefits of their practice is they keep it small so that when you come in here, you're always going to visit with a physician. And that's very, very important because he's the one who has the training to help you on that road to recovery.
Absolutely. And we like to spend time to educate patients on the procedure, the technique, and what to expect afterwards.
It's exciting. You should.
Definitely.
Thanks for your time again this morning.
Thanks, Julie.
It's Orthopedic Surgical Specialist right here in Chattanooga. Dr. Josh Lawson, the phone number, website right there on your screen. We're back after this.
Far too often, people are being seriously injured and hurt because of negligent drivers distracted by their cell phones. If you've been harmed by a negligent or distracted driver, the law is on your side. Let us